And Brian, we're going to turn now to the fight against COVID-19. Experts reporting new signs that a coronavirus surge is taking hold in Michigan. The state's weekly case update showing an average increase of 500 more cases per day, and hospitalizations have reportedly doubled since May. Doctors say the increase is driven by the BA.5 subvariant that's now sweeping the country. So for more on this, we're going to go to our chief health editor, Dr. Partha Nandi. And Dr. Nandi, are hospitalizations up because this variant is more dangerous?
Yeah, very concerning. Right now, Glenda, health experts do not think that BA.5 is associated with a greater disease severity or hospitalizations than other recent subvariants, even though the 7-day average of hospital admissions is currently at just over 5,100 per day, which is double the figures we had in May. Now, however, BA.5 appears to be more transmissible and more immune evading than previous strains. It's now responsible for 65% of new infections here in the U.S. And case numbers, Glenda, are high in the west, the southeast, and some areas in the northeast. Unfortunately, hospitals across the country are bracing yet again, right, for another surge of patients seeking medical help for COVID-19, including here in Michigan. Hospital admissions in Macomb, Wayne, and Oakland counties have risen 13% in the last 7 days, and case numbers have increased by almost 34% over the previous 3 weeks for Michigan. So not good.
So, Doc, if it's not more dangerous, then why are these hospitalizations going up?
That's a good question, right? There are several reasons, Glenda, why hospitalizations are rising. The variants are changing so much that people's immune systems are having a hard time fighting off newer variants. Overall, there are more people who can get sick now. It used to be, right, that people, when they get infected, they had a 90-day period when they were protected against reinfection. But now, new research indicates that people can get reinfected roughly 4 weeks later with another variant. Also, not enough folks are getting boosted. Only 49.5% of those eligible have received their first booster dose. And even more dangerous to me, people age 50 and older who can get a second booster, only 28% have done so. They're more at risk. So it's no surprise that immunity is decreasing in a lot of folks. And this opens the door to more breakthrough infections and also COVID fatigue. We know about that, leading to bad decisions. And some people are taking more risk and not masking up or taking precautions when they should. On the positive side, right, intensive care unit numbers are not rising alongside hospitalizations. And that is good, and that could be because doctors now have released some good tools to treat COVID. Hospitalized patients can be treated with the antiviral remdesivir, steroids, oxygen support if needed. There are also anti-inflammatory drugs like baricitinib and tocilizumab, and that can be prescribed in some cases. Having said that, though, we could see the intensive care numbers rise as BA.5 continues to spread. More vulnerable people get infected. So again, please get fully vaccinated and boosted when you're eligible, and you're less likely to be hospitalized than the folks who are unvaccinated. And it follows, if you're not hospitalized, less chance of intensive care and less chance of death. And that's what we're looking for.
All right, Dr. Nandi, thank you for the update.
My pleasure.
And if you have a health question for the good doctor, you can email him at drnandi@askdrnandi.com, or you can send it to us on Facebook or Twitter, and we'll get it right to him.